Hospital workers have been on the front lines of the coronavirus fight, working long hours, whether it be doctors, nurses, administration, and other staff working in areas throughout the buildings. But as the vaccine rollout continues, Bob Atlas, the president of the Maryland Hospital Association, says a significant portion of hospital workers across the state are refusing the vaccine.
We are hearing numbers in the 30 to 40% range within hospitals. It's higher even within, let's say, nursing homes.
In the state,
those numbers coincide with what Governor Hogan reported during his vaccine rollout update Tuesday. He said hospital workers are still behind county health departments when it comes to getting vaccinated.
Well, of course, we want everybody who's eligible to get a vaccine to get it.
Bob Atlas explained that reluctant hospital workers have likely chosen to put off the vaccine for a variety of reasons, including wanting to wait and see about possible adverse reactions. But as he and medical experts have said, the risk of that is extraordinarily low.
There's a level of new knowledge that needs to be put out there. Unfortunately, we're also dealing with misinformation. It has to do with needing to get them more information, better education about the safety and efficacy of the product.
State rollout protocols are partly meant to put some extra pressure on hospitals to get staff vaccinated. Hospitals falling short of 75% vaccine utilization, for example, won't be prioritized for additional allocations.
As the national experts have said, we need about 75 to 85% of the population to be vaccinated in order to really end the pandemic. And healthcare workers are part of that. They're a large part of the population.
And so just to give one example here, about 56% of workers in the Johns Hopkins hospital system have not been vaccinated. The VP and Chief Diversity Officer said tonight that many of those employees are still waiting to decide. Reporting live in Midtown tonight, Kai Reed, WBAL TV 11 News.